Have you ever stopped to think about what you tell yourself after situations occur in your life? For example, what do you tell yourself when you are sad that you didn't meet a certain goal? What story do you tell yourself when you get depressed that you aren't with the person you want to be with? What runs through your mind after you introduce yourself with a joke at your new job and it totally flops and everyone is left groaning?
Yeah, I'm not used to public squeaking. I piss pronunciate a lot of my worms.
From every event that happens within our life, we create a new belief about ourselves, resonating from our emotional responses. Over time, when we have a collection of beliefs, we form a philosophical view. This means a theory or attitude we use to act as our guiding principle for behaviours, and it defines who we are. Our philosophical view can be very empowering for us, or it can prevent us from experiencing the fullness of life. My name is Farah Masterson, and in this video, we're going to go over how rational behavioural therapy can change philosophical outlooks, enabling you and others to accept reality and live more positively. This is New Depths Psychology. Rational emotive behavioural therapy was developed by Dr. Albert Ellis in the 1950s. Ellis worked as a psychoanalyst originally, but found the method to be quite outdated. To Dr. Albert Ellis, the psychoanalytic techniques were not very effective at producing positive outcomes for patients. Instead, Albert Ellis believed a more efficient therapy should address the importance of what the patient is actually thinking concerning their everyday situations, instead of delving right into the childhood, like the psychoanalytic techniques would. Albert Ellis believed that healthy thoughts were the source of happiness and negative thoughts were the source of many problems. The idea that the way we think is the crucial moderator for our happiness stems all the way back to ancient philosophies such as Buddhism, Taoism, and Stoicism. Something they all had in common was the idea of detaching from our emotions and accepting the moment. As I briefly mentioned in the introduction, a philosophy is the theory or attitude we use to act as our guiding principle for behaviour and to construct our view of the self. Rational emotive behavioural therapy aims to instill healthy philosophies to replace unhealthy ones. Ellis noted that people develop unhealthy philosophies through irrational beliefs. This is because people make assumptions about themselves that do not map into reality. Instead, an irrational philosophy is based on emotions that stem from external happenings. This can blind the person to only one way of perceiving the situation, and as a result, they become so attached to their beliefs it becomes religious. The belief itself gives no credence for an alternative way. There is no nuance or room for adaptation. Meanwhile, rational philosophies are built around things that are actually occurring in the world. It requires an accurate portrayal of what is really occurring. Rational philosophies make a distinction between what a person needs and what a person wants. After a breakup, it is easy to think that you needed this person for life to be whole, but rational emotive behavioural therapy would state that you really wanted this person, you really desired this person to be a part of your life. But rationally speaking, life can go on fine without them. Making the distinction between needs and wants makes it easier for a person to experience unconditional self-acceptance. Self-acceptance separates the value someone has as a human being from their performance in certain areas in life which are attached to their desires. This isn't to say you should be lazy and not pursue things that are meaningful to you, just because you can accept yourself no matter what. It's quite the opposite. It hones your locus of control inwards and reduces anxiety from the over-concerns of needing external positive reinforcement. Ellis talks about how these personal philosophical views form through the ABC principle. Now, this is very important because it basically summarizes a huge part of rational emotive behavioural therapy, and learning this principle enables you to easily break down your patterns of thinking. I've put a link in the description to a self-help form which uses this principle, and it's really useful for assessing your own philosophies and allowing you to think more rationally. The birth of a personal philosophy starts with A, the activating event. This is typically an event which triggers an emotion. For example, I did not meet my work target. I feel stressed and sad. After the occurrence of an activating event, then comes B, the belief. This is the narrative a person uses to explain the feelings that encompasses that event. For example, I did not meet my work targets. I felt stressed and depressed. Therefore, I believe that I am a failure and that I am letting everyone down. This belief then leads to C, the consequences. This is the emotional and behavioural outcome from the belief. The belief of failure and letting everyone down, in this case, will prevent this person from striving and progressing. This person will become apathetic towards their friends and family, and all this may cause them even more depression and hopelessness than they already have. Now, a practitioner of rational emotive behavioural therapy would accept the client's initial feelings of sadness and stress from not meeting their work targets, but would then proceed to dismantling the belief system this person has and replace it with one that is rational. Instead of the client saying to themselves, I did not meet my work targets, I felt stressed and depressed, therefore I believe that I am a failure and that I am letting everyone down, the client should create a new narrative that is more nuanced and based in reality. They might say instead, I did not meet my work targets. I felt stressed and depressed. But I believe that there are things that can change in this situation for the better. And if people think that I am letting them down, it isn't the end of the world. I need to accept myself where I am now. That's the only way that I can get what I desire from this situation. So to conclude, rational emotive behavioural therapy can be very effective for changing thoughts and behaviours. I personally have used rational emotive behavioural therapy on myself a couple of times using the sheet in the description. Rational emotive behavioural therapy can be really powerful for acting as a catalyst for breaking down some thought patterns that you may have had or are experiencing currently. If you end up in a situation that is causing you a lot of pain because of your overthinking of the situation, and you can clearly identify that you are being illogical, you're overthinking, going to rational emotive behavioural therapy, or even just using the self-help forms can actually feel like a rebirth of yourself. I know that's bombastic language, but it can be so nice when you pull out some irrational thoughts that just aren't based on reality, and you can see the world for what it really is and all the avenues that would have been blocked beforehand. So I highly recommend. In the next episode about different therapies, we'll be going over Carl Rogers' person-centered therapy. I hope you all enjoyed. If you feel you liked it and want to learn more, please hit the like and subscribe button. Take care and see you next episode.